Welcome to the Ethnomed Podcast, a community voice in the clinic. My name is Dr. Duncan Reed, a physician in the International Medicine Clinic at Harborview Medical Center and medical director of Ethnomed, a web resource for providers and patients with information for cross-cultural care. Today we are continuing our interview series called Provider Pulse, where we elevate diverse voices from across healthcare fields to learn the paths people took to their current roles in healthcare and how their cross-cultural experiences have helped them provide more informed care to diverse patients. Whether you are an undergraduate student considering a career in healthcare, a practicing health professional, or a member of the community, these conversations are for you.
I think immigrant families always just go to doctor, a lawyer, engineer. You can only do engineering, doctor, or nursing. So that was the only choices that we had. We didn't have any other choice. But ever since I was young, I was always really into art. I like drawing, painting, any kind of form of art, and eventually photography. That was very quickly discouraged to pursue something in the arts. To be honest, when I was thinking about public health and got in, I was doing the program, I felt imposter syndrome because this is something I just found, and I didn't feel like I was as passionate about it as my fellow students. And sometimes I do still feel like that. Sometimes I still feel like the imposter syndrome is really overwhelming because this wasn't something that I sought out. I love it. I love what I do, but it's not like a burning passion that other people feel.
On today's episode, we speak with Catherine Evangelista, an administrative specialist in the Community Prevention Unit at Public Health, Seattle and King County. She reflects on her identity as a Filipino American, the cultural and family expectations to pursue success in certain fields, and the challenges she faced during her undergraduate years without clear mentorship. Catherine shares how her career path was not driven by a singular passion, but instead shaped by navigating, and at times resisting, the constraints around her.
I'm Catherine Evangelista. I'm one of the admin staff for the Community Prevention Unit within the King County TB program. I was born in the Philippines, and my dad and my older brother moved to Canada first so that my dad can work there. And then my mom's parents had moved to Washington beforehand, so they petitioned us to move to Washington when I was 4. So we've lived in Washington since then, and we haven't moved anywhere else. I basically grew up here. We lived in Shoreline, Washington, and then we moved our way up to Everett just because housing was a lot easier to find there. My direct family is actually here, except for my parents. They went back.
How was your experience in middle school and high school? Did you feel like an outsider coming from an immigrant family?
I did feel like a kind of an outsider, just with numerous factors like being Asian and coming from like a different socioeconomic background than the other people at my high school. So it was just kind of like a weird in between that I didn't fully fit in, but we live here, so we try to fit in.
Were there many other students of Asian background in the school you went to?
There was a good amount, and I feel like I did kind of relate to them more, but I think the socioeconomic background was the biggest difference between us because we lived in a richer neighborhood. I felt like our family was more middle class.
Do you identify as American?
I identify as Filipino, and I don't really identify as American, but I grew up in an American background. And so growing up, our teachers in elementary school are always like, you have to speak English to your kids. They need to assimilate to the culture. And so I understand Tagalog and I can speak a little bit of it, but I'm not fluent. As an adult, I'm also starting to learn more about Filipino culture and our roots. So I identify as Filipino, but I still have not a very in-depth knowledge of the culture. So it kind of makes me feel like that part I'm also kind of in between.
Do you know where in the Philippines your family is from?
As far as I know, they were all born in Zambales. I don't know of any extended family that was born outside of that province.
How about your parents? What fields were they in?
So I mentioned before that my dad went to Canada first. And I think that was just easier for him to get a job there. He worked in accounting, so he found different companies there. And then my mom's side of the family, the job related to the naval base, because Olongapo is a port for the U.S. naval base. So my grandparents worked there, and then they were able to get citizenship and was able to go to Washington, and that's how they made it to America. My mom, when she was in the Philippines, she was also working in some finance field for the U.S. naval base. And that's how she came into the U.S. So she ended up working in finance as some kind of accounting person for Nordstrom. Yeah.
So, how was your experience in middle school and high school? What were you thinking about studying?
I think immigrant families always just go to doctor or lawyer, engineer. There's three of us, my older brother, me, and my younger brother. We were all told, you can only apply to UW. You can't apply anywhere else. Otherwise, you have to pay for it. You can only do engineering, doctor, or nursing. So that was the only choices that we had. We didn't have any other choice. But ever since I was young, I was always really into art. I like drawing, painting, any kind of form of art, and eventually photography. That was very quickly discouraged to pursue something in the arts. So in high school, we were really focused on all the sciences and stuff like that. I enjoyed them. We did okay in them, but it wasn't something that I was like, I really need to go more in depth into this field. Then applying to college and then trying to figure out what I wanted to do in college was kind of a struggle because I for sure wasn't ready to be a doctor, to go through all those years in medical school. Because after watching my older brother, at that time, he finished a double major in biochem and chemistry on his way to be a doctor. He got a lot of rejection letters, and just seeing him struggle through that was very hard. So that's not something that I wanted to go through. So I decided to just try engineering because I was fairly good at math. And then college comes, take my first quarter at UW, and I was like, this is not for me. And so trying to figure out like what to do next was also a struggle. So I thought maybe like, oh, I could do nursing because I kind of already done the prereqs for that. But a year into it, I decided that maybe this isn't for me. So I took a year off. And then in that year off, I discovered public health.
How did your parents feel about that?
I think they were more understanding after my brother was going through all of his college stuff. And I was already working at that time as a CNA at the UW hospital. So I was already working full time. So I don't think they were that worried money-wise and career path-wise, because I think they think I would still stay in the medical field because I'm already in the field.
So what I'm hearing from you is that this immigrant identity already colored what fields of study were acceptable, what things you needed to strive after. How much older was your brother?
6 years older.
Seeing your brother do all the things that he was supposed to do and the toll that it took on him, perhaps your parents were more lenient with you because of that. It seems like a very brave decision to take time off after 2 years of undergrad to kind of recalibrate.
Yeah, I think also because it's expensive and I don't want to keep spending so much money on something that I may or may not get into. I became a CNA when I wanted to focus on nursing. And during that time off, I started out at a nursing home and I really liked working with individuals, seeing them every day in this environment. The nursing home is very hard, especially for smaller people. It is very physical work. So I ended up finding a job at the UW Medical Center. They are very well staffed. You get to learn a lot because I was in just like an overnight stay unit. I still learned a lot from the nurses there and people's experience, other CNAs and how they got there. And I was really inspired by the other CNAs. For the most part, CNAs at the hospital are already on track to go to nursing. So they are very inspiring just to hear what their experiences are like. For me, even though I get to hear their experiences and their stories and their motivation, it didn't make me feel more convinced that I could do it. Like it was almost overwhelming, actually. I don't know. I think for me, I was just more overwhelmed by how much time and effort that they're putting in. And I didn't know if I could do that. When I was in school, I was a commuter and like I had very strict parents where I have to go only school and then go back home right away. So I didn't get to spend a lot of time on campus and I didn't really know about guidance counselors and I didn't really know how to ask for help or guidance from teachers because I don't think I was really brought up that way. When I'm making all these decisions about which career path to take, I never talked to a guidance counselor. I didn't have a mentor. And even during classes, I sometimes went to office hours to ask for help, but the classes were so large that it was really overwhelming to try to ask for help. Just that time was very overwhelming and hard to ask for any kind of guidance. So that whole year was me just researching, well, okay, I'm already kind of in this field. What can I do with what I already have in my pocket? And I can only go to UW. So what can I do with what I have at UW? And then I was just researching like classes and programs, and that's how I found public health. And I was looking at the prereqs, and I thought, oh, okay, I think I can do this. But even then, I wasn't sure what I wanted to do exactly with public health. You graduate in public health, but afterwards, it really depends on if you want to do like your MPH, EPI, focus. So there was no focus. And a year into the program, I was like, well, okay, what am I going to do after this?
So it seems like it was a choice of convenience in a way because you were triangulating what made sense with all your restrictions. Is it something that you came to enjoy and appreciate? Or is it something that still felt like this is the best option I have available with my constraints?
It took a long time. Even graduating, I wasn't really sure what my options were besides applying to literally King County Public Health. I wasn't sure if there were private organizations or non-governmental agencies that were public health. I went on the King County website and Googled public health jobs. But yeah, it took a long time even after I started working here.
So you returned to the University of Washington to complete a bachelor's degree in public health. How was that experience?
I liked it a lot. There were things that I learned that you don't really know it's public health until you were like in the public health lens. So I'm like, oh, okay, I could see that, like social determinants of health. You see all that stuff in the news presented in a different way. And then when you're like in the public health lens, you're like, oh, that click, the community health programs that are offered to different groups of people. I never really thought that was like a public health thing. So learning about public health and what it does for the community, for certain community members, and then learning about equity versus equality, that was like really eye-opening. But even then, going through the courses, it was still tough for me to decide like where is this going to go. Our capstone projects, we had choices of what we wanted to do for our capstone. And there were so many different capstone projects that we could choose from. And at that time, I wanted to focus on my health physically. And there was a project that you walk with elderly folks in different settings. There's like a north and the south. The north, there are sidewalks, traffic lights, parks. And then on the south side of Seattle, there's not really that many sidewalks, or you have to go through different kinds of neighborhoods that aren't always so safe. And so I chose that as my capstone. And I liked it because you get to talk to older folks and hear their stories. But at the same time, I kind of regret it just because it didn't really set me on a path where I could make connections to the career path. Some of my friends went more on the financial aid side with helping people with taxes and helping people go through legal documents. In this field now, I'm like, oh, well, that kind of experience would have been so useful working with the TB program because so many folks would need that help, or at least you'll have some knowledge of how it works. I kind of went with my gut feeling at that time and not really doing so much research about the different options. After graduating, I got a job at the public health lab as an administrative, like an admin person. And that's when I met contact tracers, disease research intervention specialists from different programs like the STI program, the TB program, CD-EPI, and learning what they do. And that's kind of like, oh, okay, that sounds like I could do more than what I'm doing now at the public health lab. So that is kind of where my career path has been going since then.
And what's your title now?
Administrative specialist with the community prevention unit.
And what does that mean? I've seen you fill a lot of different roles.
The tasks that I have been doing have kind of fallen into my lap, not because I'm an admin, but just because of the opportunities that were available. And I have my supervisor to thank for all those opportunities.
Who's your supervisor?
Caitlin Gardner-Torner. She's amazing. I told her that contact tracing is something that has been an interest for me. And because of COVID, there have been a lot of positions open for it, but it's also become a very in-demand job. So gaining experience was kind of the first start. And so I've been able to shadow outreach workers who go out into the field and watch patients take their medications, shadowing the DRIS folks in our program and seeing what they do. Just little opportunities where I can get a glimpse of how they talk to people, how they get information out of people, the approach that they take, how to build rapport with them. It's an art.
What's next for you?
I honestly don't know. There's kind of different pathways right now because I've been doing different projects like social media stuff, shadowing the DRIS and like going in that direction. I help co-manage a team of navigators. And so getting leadership experience, so project management, coming up with ideas on how to build educational material. So I don't really know. I guess it really depends on what opportunities come.
It sounds like a really good working environment. I've worked with you guys enough to know that it seems really nice. Like I want to work there. Maybe you didn't have mentorship in school, but having a really good boss or supervisor at work can actually provide a lot of the elements of good mentorship.
Yes, 100%.
And it sounds like you're getting exposed to a lot of things. And maybe one of these things is the next thing for you.
Yeah.
Public health sounds like a great option that can tie in a lot of these different interests.
To be honest, when I was thinking about public health and got in, I was doing the program, I felt imposter syndrome because this is something I just found. And I didn't feel like I was as passionate about it as my fellow students. And sometimes I do still feel like that. Sometimes I still feel like the imposter syndrome is really overwhelming because this wasn't something that I sought out. I love it. I love what I do, but it's not like a burning passion that other people feel. So whoever is listening, it's okay to pursue it and just see what there is to offer because there are a lot of options in public health. Just because you didn't do nursing or being a doctor or a lawyer, don't be embarrassed about the choices that you make because it is hard. Choices are hard, especially when it comes to your career path.
I think a lot of the way we're trained to talk about our career story is a story about passion. And I think that it might be sort of this American narrative. I think what you're pointing out is it's reasonable and practical to find a field of study or a job that perhaps you weren't necessarily passionate about all your life, and that you can still find meaning in it and pleasure as a field of study or as a career. The path that you ultimately take for your career doesn't necessarily need to match this narrative of burning passion, of desire, present at birth or childhood, which we so often seek. Thank you so much for your time joining us today, Catherine. We hope this episode has provided insights that help listeners better understand cross-cultural perspectives in navigating a career in healthcare. On today's episode, we spoke with Catherine Evangelista, Administrative Specialist at Public Health Seattle-King County. Her reflections as a Filipino American offer an alternative to the passion-driven narrative a career shaped not by a single spark, but by small choices, resilience, and navigating constraints. Her story is a powerful reminder that purpose and meaning can emerge gradually, even without a clearly defined calling. Here's a preview from Dr. Edwin Wong, our guest on the next episode.
I came back to the U.S. in New York for college at New York University. I did feel a little bit of a culture shock. The thing that sticks out to me was kind of the Asian stereotypes specifically, like moving from Singapore and then going to New York, and there were just a ton of random Asian stereotypes that were thrown at me that I didn't realize were stereotypes. I had several years after college where I wanted to do medicine, but I was getting a little bit disillusioned because I applied a couple of times and didn't get in. It really hit my self-confidence and hit my identity, but to be honest, I think having those years of a little bit of struggle, I think helped appreciate when I actually got in. And I had a lot of fun actually in medical school, and I enjoyed medical school.
Be sure to visit our website at ethnomed.org for additional resources. Also follow us on YouTube and Instagram at ethnomedUW and on LinkedIn. Thank you.